One, two, one. So welcome to Ep.1 of the Nathanimalism podcast. I don't really know what this podcast is going to be about, other than it's probably going to vibrate heavily towards American politics and the presidential election that we're in the midst of at the moment. But, I don't really have any free time, so I don't really have much time to prepare anything. So it's basically going to be me just talking off the top of my head about stuff that I care about. And I thought the first episode we'd talk a bit about the American healthcare system, because who isn't fascinated by that? I think it's quite an interesting thing to talk about if you're not an American, because it gives us some perspective on just how bad a healthcare system can be, and that perspective can be very helpful when we are critiquing our own healthcare systems in non-American countries. So what I thought we'd do, we'll talk about the US healthcare system, how it works, what it is, and then we'll move on to the kind of the state of healthcare politics in the US today, especially in the context of the presidential primary and the Democratic Party. So, the first thing to know about the US system is that it depends almost entirely on private health insurance, meaning that people purchase private health insurance from a health insurer. Then when they need to access healthcare, they claim on their insurance, and their insurer pays for the care. Now, immediately this throws up a number of pretty extraordinary problems. The main one being that there is no way that a market can actually function when it comes to delivering healthcare. Why is that? Well, the simple reason is that no insurer in their right mind would ever insure a sick person or a person that's likely to get sick, which is kind of annoying given that these are the people that need to access healthcare. You're left with a situation in which the people that most need care are least able to access it. This is obviously patently ridiculous. And it actually led to a situation where there were 50 million Americans that had no health insurance whatsoever, and that severely limits their access to healthcare full stop. It also led to the emergence of a list of what were called pre-existing conditions, a list of conditions that had you ever had them in your life, you were not eligible for health insurance full stop, so you couldn't get insured. An example of this was asthma. If you ever had asthma, you couldn't get health insurance. It's absolutely crazy. So if we assume that our goal is to make sure everybody has access to healthcare, excuse me, that's wrong. I shouldn't say access. If the goal is to make sure everybody has healthcare, then this is obviously a fatally flawed system. So when Barack Obama was elected president, he passed what was called the Affordable Care Act, which parts of which are still are working today, even though Donald Trump has managed to successfully dismantle large parts of it. And Obama saw this as a good compromise plan, by which I mean it was a conservative plan. It was an attempt to sort out the fact that there were 50 million people without access to health insurance, but whilst maintaining the private insurance-based system. So again, it was a conservative plan proposed by a right-wing think tank. And what they essentially wanted to do was prevent insurers from blocking people from purchasing insurance because they had a pre-existing condition. Now, this is problematic because if you're going to force insurers to cover people that they're not going to make any money on because they're too expensive, it's not in their business interests to do so. So how do you make it profitable for them to do that? Well, that's where the second component of the Affordable Care Act came in. It included what was called the individual mandate. And the individual mandate was a government edict that made it that legally required every person in the country to purchase private health insurance. Now that sounds a bit oppressive, doesn't it? Well, it is. And basically, the idea is that by doing this, you force a lot of the healthy people that are not likely to get sick and therefore may not have bothered to purchase health insurance into the risk pool, meaning there are more people in it paying their insurance premiums. And that meant that there are enough of those people in the system that the insurers could afford to cover people with pre-existing conditions. And it was somewhat successful. It wasn't a marked improvement from the system that came before, but it wasn't a fundamental change. It wasn't that good, and the amount of political capital that was spent on it was huge. And the fact that it was a right-wing plan, so Newt Gingrich supported it for a number of years. As soon as Barack Obama advocated for it, it became a left-wing government takeover of healthcare. Mitt Romney even passed this plan in Massachusetts when he was governor of Massachusetts. But now it's a socialist takeover of healthcare by the government. It's crazy. But for those minor improvements that it did make, a number of gaping flaws with the system that come from the fact that it's based on private insurance remained. You still had to pay astronomically high premiums. We're talking about $1,000 a month on average. $1,000 a month, $1,000. Now that $1,000 a month plan, you're talking about $12,000 a year for your health insurance, come with deductibles, as you'd expect. Like in the UK, for example, we expect to pay a deductible when we claim on our car insurance. Well, imagine having to do that for your healthcare. This is incredible for us to even think about. But you might have $1,000 deductible. So imagine you actually need to go to the doctor. We can actually run through this. So imagine you need to go to the doctor quite urgently. Well, you've got a choice. The nearest surgery that you could go to or clinic is not in your insurer's network. So another beautiful facet of this obscenely complex system is that your insurer will have a network of hospitals and healthcare practitioners that you can go to, and they will pay for it. But if you go to a hospital or something, if it's an emergency that's not in network, they won't pay for it. So if you're in an emergency and you want to go to the nearest hospital that's not in network, guess what? You're paying for it out of pocket anyway. So for example, say you go to the doctor. Say the doctor is in network. You go for a checkup that's covered by your insurance, and there is a problem, and the diagnosis you receive is something that obviously you couldn't predict, you weren't expecting, but your coverage does not cover you for that specific diagnosis. Now, guess what? You have to pay for it anyway. The doctor prescribes you some drugs to treat it. Well, your insurance has also got what's called a co-payment. So you have to split the cost of this drug with your insurer. So how about this? You pay $1,000 a month for your in insurance premiums. You have $1,000 deductible. So when you actually need to access care, say it's to go to the doctor or something like that, you pay out of pocket because it's less than $1,000. The insurance pays for none of it. Then you get drugs prescribed and you have a copay, so you have to pay for that out of pocket again. As you can see, this is a very, very expensive, complicated process. And this, by the way, this is after you've already shopped around for the best policy. And these are the things that Obamacare really didn't address in any meaningful way. There are still hundreds and hundreds of thousands of Americans going bankrupt every year due to medical bills and medical debts. There are still tens of millions of people that are uninsured. The premiums are still astronomically expensive. They are increasing in price at a lower rate than they would have been had the ACA not been passed, but they're still going up. It's still very expensive. And arguably the worst part of it is that people still live with the profound insecurity of perhaps losing their insurance without even realizing it. It's a horrible thing, I imagine, to have to live like that. So this was as good as Obama dared try for when he was president. And it's basically where we are now, where we've got this obscenely complicated bureaucratic system where we have hundreds of different health insurers, competing with one another, duplicating administrative tasks, incredibly wasteful and inefficient. I believe it's 32 cents of every dollar spent on healthcare in the US goes on administration and bureaucracy, whereas for Medicare, their public insurance for the elderly is about 8%. So it gives you some idea of the difference. Now the question is, where do we go from here? It's a very, very controversial question in the Democratic primary. And there are two major paths forward. Two. One is rubbish. It's not a good plan. And one is very good. So we're going to start with the rubbish one. So the rubbish one is being proposed by Joe Biden. He's the only real serious contender, if you can still call him that. I think it's fair. He's still polling pretty well. Kamala Harris has a similar plan, but hers is just an absolute piece of trash. It's like somebody took a piece of garbage and like finally honed it and used polls as like the template, and it's so complicated. It would be impossible to implement, and it is literally just a ludicrous joke of a proposal. But we'll take Biden's, and it's called the public option. Now, the public option is basically like you would go to, Blue Cross or Aetna or any of these private insurers. You would go to, it might be Medicare. Some people call it Medicare buy-in. We'll talk more about Medicare in a sec. Or whoever the public insurer is, you would go to them and you would purchase your insurance from them. The idea being that because you've eliminated the profit motive from the transaction, it would allow the federal government to provide a cheaper, more comprehensive insurance program. And because of this, the health insurance companies would either have to lower their costs in order to compete, or expand the benefits offered by the program, or leave the marketplace. That's the idea, and that's the reason they oppose it so vociferously. The problem with it, and that's true. What I just said is true. There is some truth to that, but there's also a huge, huge problem with it. And the problem is that, like I intimated before, it's in the interest of the health insurance companies not to take on sick people. So if you have a public option, it would be fantastic for them. Even though they would have to compete with the public option with everybody, it would mean that they would be able to design their plans in such a way that it kind of forces the sick, expensive people onto the public purse. And they can keep the cheap, healthy people that are going to be paying premiums but not necessarily claiming on the insurance so much. It would be extremely expensive for the taxpayer. Politically, it would be very damaging because it would allow Republicans to say, well, look at this. You see how expensive this is? We told you it would be expensive. And, the federal government can't do anything right. It can't compete with the private sector, blah, blah, blah. So I think it would be a devastatingly bad thing to pursue, especially when there's another plan on the table, which is called Medicare for All. Now, this is being proposed by Bernie Sanders. Elizabeth Warren is also proposing it, but I'm going to be honest, I don't believe that she would even try to implement it if she became president. I don't think she'd be up for the fight, to be honest. That's not hating on Warren. I think she's a phenomenal presidential candidate, but I do not think that you should support her if Medicare for All is a high item on your agenda. So what is Medicare for All? Well, let's start by talking about what Medicare is. Medicare is a public insurance plan that every senior in the US, that's somebody over 65 years old, is automatically enrolled on. And it covers all of your basic healthcare needs. What Bernie Sanders' Medicare for All proposal does is simply expand that to cover everybody in the country, and it makes it comprehensive. It makes the coverage it offers comprehensive. So what would the effect of that be? Well, it would mean that from the moment you're born till the moment you die, you have health insurance. You are covered, full stop. There's no more shopping around for the best policy. There's no more worrying about whether or not you're going to have coverage at a time that you're going to need it. There's no more worrying about whether or not you're going to lose your job. There's no more worrying about whether or not you'll be able to change your job because the job you want to move to might not have as good a healthcare benefit. It would relieve the stress and time burden on businesses having to purchase and provide health insurance for their employees. It would have a profound effect on people's lives in ways they can't even imagine. I mean, I compare it to my experience as a Brit. I have never in my life ever spent a single second worrying about whether or not I'm going to have health coverage when I'd need it. I've never received a medical bill in my life ever. I mean, to us, to people in the UK and France and Germany, that's just par for the course. We expect that. In the US, that is completely unimaginable, that I could be nearly 30 years old and not have ever had a medical bill. But it's true. I've never had to get on the phone to my insurer to argue with them about whether or not they're actually going to pay out for this healthcare procedure that I need. I've never had to worry about going to a specific hospital because it's in network, or worried about not going to a specific hospital because it's not in network. If I need to get treated because I've accidentally cut my finger down to the bone with my new filleting knife, I just go straight to the minor injuries unit. I walk in, I tell them who I am, I give them my address, I sit down, I wait for 20 minutes, I get seen, I get treated, I leave. The end. Job done. That's it. I don't need to take my credit card with me or my debit card. I don't need to take my passport with me or any ID. I just get treated. And it's amazing. Medicare for All would give an American citizen a similar experience when it comes to healthcare. Because you're insured, you're covered automatically, you would never again have to worry about arguing with your insurer or any of these things, because the coverage is there automatically. You're covered. That's it. You'll never again have to worry about paying health insurance premiums. You'll never again have to pay deductibles on top of your premiums and co-payments on top of your premiums. And the best part of all is that it will be substantially cheaper. Why would it be cheaper? Well, for the same reason that Obamacare meant that health insurance companies were able to cover people with pre-existing conditions by forcing more people into the risk pool. This would have the same effect, only it would include everybody in the country being forced into the same risk pool. Now, this means that the people that aren't necessarily accessing healthcare at that moment are still paying in through their taxes, so that people that are accessing healthcare at the moment are having it paid for by everybody. Now, this obviously some people have a problem with this, and the immediate reaction that you have when this is brought up, the reaction is, well, how can you justify that? I mean, you always hear, who's going to pay for it? This is going to cost $30 trillion over 10 years, which is true. Who's going to pay for it? Who's going to pay for it? Well, you're going to pay for it. Who do you think pays for my healthcare? I do. I work a lot. I pay taxes. Happy to do it. I pay for it. The difference is I pay substantially less than you do in the United States. Healthcare spending in the UK works out about $4,500 per capita per year. Healthcare spending in the United States, it works out about $11,500 per capita per year. Think about that. You're paying almost 3 times as much as I am for more insecurity. You have more out-of-pocket expenses that we don't have. You have the stress of having to argue with your insurer when you actually need them to pay out for something. You have the stress of worrying about whether or not the healthcare you're accessing is being provided by an in-network healthcare provider. It's a ludicrous system. So when you hear people like Joe Biden talk about, or not just Joe Biden, there's Tim Ryan, all these other nobodies that are running, argue with Bernie about this point. You say, why are you taking away people's private health insurance when they like it? They like their insurance. If they like their insurance, they should be able to keep it. But this is a fundamentally disingenuous point, because it ignores the context in which the American experience of healthcare takes place. if you're living in a constant state of insecurity about whether or not you're going to be able to access healthcare, and if you do access it, whether or not it's going to bankrupt you, the idea of a politician coming along and saying, okay, we're completely changing the whole system, is scary to some people that have an all right health insurance program. Of course it is. But if you give them the full picture, okay, we're going to take away your private health insurance because the law says private health insurers are simply not allowed to offer duplicative care, or they're not allowed to offer programs that cover things that you're already going to have covered under Medicare. If you tell them, okay, you're going to lose your private health insurance, but the reason you're going to lose it is because we're replacing it with this comprehensive coverage from the moment you're born till the moment you die that you never have to shop around for. You just have it automatically forever done. You never have to worry about deductibles. You never have to worry about copays. You never have to worry about networks. You never have to argue with your insurer to get them to pay out. You're just covered, full stop, the end. And for the pleasure of that, rather than paying $10,000 a year in health insurance premiums, you're going to pay $4,500 in federal income taxes. I mean, do you really really think that Americans love their private health insurance that much that they would rather pay more than double to a private insurer rather than the federal government for all of those horrible things that come with the private insurance experience? I don't think so. But when it comes to the politics of it, Medicare for All is a better option than the public option. Why? I mean, this is something that really gets my goat in the debates. You know, they say, Bernie, you're not being reasonable. You're not being reasonable. You'll never get this passed. Well, guess what? If your plan is a public option, you ain't getting that passed either. Do you really think that the private health insurance industry is going to be like, you know what? Pete Buttigieg has a compromise plan. We'll go with Pete, and that way we'll meet in the middle and we'll have an agreement and everybody's happy. No, sir, ain't happening. They've already said that they're opposing the public option just as vociferously. So if the private health insurance industry is not going to be a partner in their own demise, which they wouldn't be, let's keep it real, and they're going to oppose a public option just as vociferously as they will Medicare for All, the question then becomes, well, how do we overcome this? And the only way that any of those plans will get implemented is if there is a huge, massive, unprecedented groundswell of public support for it. Millions of people on the streets fighting for it. Do you really think that they're going to come out en masse for the public option and go, yes, compromise. Let's have a plan that's not as good as it could be. Yeah. Ain't happening. A.D. Barkin made this point beautifully. That's not going to happen. It will happen for Medicare for All if there is an honest debate about what it is. So I think the public option is not worth the political capital that would need to be invested in order to get the conversation started, let alone get it passed. It is worth it for Medicare for All. It's a better system, it's cheaper, it's more comprehensive, it will radically change the American experience of healthcare for the better, and I commend Bernie Sanders, who obviously I like quite a lot, for single-handedly changing the game when it comes to healthcare in the US. His campaign in 2016 was probably the most remarkable campaign in modern American political history, more so than Obama's. I think that's safe to say, in terms of the how much it shifted the dial in the policy discussion. So that's it, basically. That's me ranting about healthcare for a bit. As I sort of think about all of these problems that the US system has and how clear the solution to them is, and how difficult that solution is to achieve because of the corruption and lobbying of the healthcare industry and the weakness and cowardice of American political leaders, I reflect on how fortunate we are in the UK, and I am, to have the NHS to have had it survive for so long. because it's not like there are people that are trying that. It's not like there aren't people that are constantly trying to undermine it. There are. I mean, our current health secretary and our previous health secretary, Matt Hancock and Jeremy Hunt, respectively, both of them, when they were given the job, their only public statement on healthcare and how they viewed it was that they both thought that the NHS should be dismantled and we should move to a private insurance model. I mean, it's utter insanity, because we still have this delusion in the UK that privatized equals cheaper, which is complete bullshit, as I've just demonstrated. The problem is that just because a cost is being borne by individuals rather than the government, that doesn't mean that money is not going to be spent. It just means it's going to be spent in a different way. And I sincerely hope that we get more conscious of just how fucked up our healthcare experience could be, because of course there are problems with the NHS that we can and should point out, but keep it in proportion, okay? Keep your head screwed on right. It could be a lot worse, and it is a lot worse in the US. So that's one of the reasons that I think that Bernie is to be honest, the only choice worth talking about, worth thinking about at the moment. Elizabeth Warren is obviously leaps and bounds ahead of everybody else running except for Bernie. So I don't place all of the candidates in the same category, all of the non-Bernie candidates. But Bernie is by far the strongest on this. And as I intimated before, the health insurance industry will not happily let itself get destroyed overnight by this piece of legislation. It's a $500 billion industry. They will deploy every cent of that capital to defeat this. And if you've ever wavered on this policy before, ever, even a little bit, you're going to crumble when you get into the White House, and this lobbying pressure starts getting applied to you. You won't have a chance. And Bernie has never wavered 1 millimeter on this. He's been arguing for this for 30 years. So I implore every American listening to this, or both of you, I don't know, no one's going to listen to this anyway, to join Bernie's campaign and start fighting, because there's two pretty devastating polls that have just come out, and it's not good. So yeah, I'm going to shut up now. Thank you very much for listening. I can't imagine anybody got this far, but if you did, well done. And I'll see you next time on Nathanimalism.